Okay, hello and welcome. Today we're just doing a posture assessment. We're looking at posture in seated, then we're going to look at posture in standing, as well as noting kind of a posture during movements. For a general posture assessment, when coming in, observing the patient in seating, we want to observe the posture that they're taking naturally, kind of the posture of their shoulders and their hips in the seated position, as well as the balance posture that they have to take in seated. The patient's not using his hands, so he's able to hold himself in the seating position, which means he's got good balance as well. If we wanted to assess balance in seating and look at posture that way, we could ask the patient to not use their hands for support and possibly close their eyes to assess balance that way. But we're just going to continue assessing posture. I also want to make sure to look at the lateral view. So I'm going to take a look at the patient's posture from the side. And think of the plumb line, think of a straight line, and check the alignment between the ears, the shoulders, and the hips in the seated position. I want to note the alignment if the shoulders or the ears are drastically forward or backwards, and how the alignment is between those. In this patient, everything looks pretty neutral. The hips, the shoulders, and the ears all align straight, so that means the spinal curvature is normal as well. I can note if there's any excessive spinal curvature of kyphosis or lordosis. Next, I'm going to kind of come behind the patient and assess the posture of the pelvis in the seated position. I can put my hands on the patient. I'm just going to touch their hips. So I want to assess the patient's pelvic posture, looking for any pelvic tilts of anterior or posterior alignment. I could ask the patient to kind of adopt an anterior pelvic tilt or a posterior pelvic tilt. If they'll just kind of lean forward for me briefly and then lean back. Very good. I can kind of note the movement and then just like I normally would. Note the movement there as well. I also want to look at pelvic obliquities or a change in the height of the pelvis left to right. So I want to note if one side of the pelvis is lower than the other. I can also look at skin folds for this, noting any differences. I'd want to do that with the patient's shirt off, but for now I'm not noticing any differences in the height of the ASIS. Or the iliac crest that I can kind of feel with my fingers here. So it means that there's no pelvic obliquities present for this patient. I also want to note weight shifting in this position. So I'm going to inform the patient I'm going to just put my hands under your butt, and I just want to feel how the weight is shifted from left to right. So I'm going to do that now. If you lean forward for me just real quick. Very good. Lean back. Good. So I'm noting kind of an even weight shift from left to right. If you will just shift onto your left hip for me. Good. And shift onto your right hip for me. Good. And you can relax. So the patient was able to shift weight from left to right and accept weight evenly on both the left and the right hip. So it's very good. So that's kind of our general posture assessment in the seated position. If you'll go ahead and stand up for me. We also want to assess posture in the standing position. So here I'm going to kind of take my lateral plumb line again and note the alignment between the ears, the shoulders, the hips, the knees, and the ankles as well this time. So I'm kind of noting if the ankles or the knees are in front of or behind the ears, or kind of my theoretical plumb line here. But again, the posture is very neutral. There's no extreme curvature in the legs or the hips. The knees are slightly anterior as the patient's kind of standing here, but nothing abnormal. So the patient has normal posture here and standing kind of neutral. Again, I'm going to assess the hips now in standing. Are there any obliquities here or any weight shift distribution differences? Again, the patient looks normal. There seems to be asymmetry between the shoulders as well. So that's good. I could again assess kind of skin folds as well in standing and how they kind of are accepting that weight. Again, like I said, with weight shifting, we want to assess too how the patient's able to stand or shift their weight from left to right. So I could use force plate analysis or put my hands underneath the patient's feet. For now, I'm just going to ask the patient to shift from left to right. So you stand on your left foot, stand on your right foot. Good. The patient's able to shift their weight on both feet evenly and accept the weight on each leg. And then you can go ahead and take a seat. And then we would also want to assess the posture with different movements. We could assess the posture during gait, or how they're able to walk upstairs, or maybe to assess their posture while they're doing things like they might do during ADLs and IADLs, grooming themselves, or standing over a counter or something like that. We want to make sure that we're assessing the posture in these different movements, as that kind of cues us as to how their motor control and sensory control is during their daily life. So that was a quick general posture assessment. Thank you.